but I just.
Thank you very much. I'd like to call the Board of Health for October 12th. And the first thing would be the approval of the September minutes. Looking for a motion.
Well, I think we just had Flavia just sent some updated minutes
I didn't know
as
that.
of two minutes ago, which I haven't had a chance to read, so.
It's like Coquia must have done it.
So
not
Coquia,
Flavia.
not Flavia.
Okay.
Coquia,
Okay.
sorry.
Why don't you go
Coquia
ahead
sent-
and- you want to catch up on those?
Yes.
Okay.
Because I can't see the, on the thing that on my phone, because I saw it in my car, Stephanie had nicely put some new updates, but I didn't see what she made. It looked like the same notes we had before.
Okay, so.
Well, thank you very much for the opportunity. There were a few minor text edits, but the ones that I have significant implications were that it stated that under talking about the polio outbreak in New York, it stated that the virus doesn't cause a problem in individuals receiving the immunization, but can cause a problem in individuals who are unimmunized. And we amended that sentence to reflect the fact that we were talking about the oral polio vaccine and not the raw virus itself. So that was a clarification. There were some other minor clarifications. Let me see if I can pull them up. One was under situational update epidemiologist, questions and comments. It stated that the flu vaccine has a few different kinds of vaccines, different types of flu, and that was just clarified to say there were a few different varieties of influenza material that were in one vaccine. So it wasn't vaccines embedded in the vaccine. I recommended that we spell out the PEP and the PREP, since the minutes are the thing that the public looks at. And in general, I think we either should have a lexicon that accompanies all of the minutes or spell things out, because we are reverting to a alphabet soup of acronyms. Otherwise, everything else was just really minor semantics, which I wouldn't even have brought to attention were it not for those two material changes. Thank you very much.
Chuck, any questions?
No, that sounds fine. I would agree with that. Thank you.
Yeah, I don't
you.
have them in front of me, so. Still looking to move the minutes of the September 14th meeting?
Yes.
Okay, we kind of jumped
Second.
ahead. Okay, and those in favor?
Aye.
Good, thank you. Moving on, is that okay? Situational update?
Oh, our EPI is not here today.
Okay,
I don't know if Flavia can provide any information or not. We didn't talk about that specifically, but as far as the typical situational update,
Yep.
we're unable to provide that today.
okay,
I did not prepare one.
okay. Smart move. Next, I would like to go to Bobby, AKA Heidi.
All righty.
Will you be doing 2 reports, or?
Yes, I will be doing the community services,
Okay.
and I will do environmental health
Okay,
when I'm
what-
up for that.
Okay.
First of all, I know that Bobby likes us to read our mission and vision. Our mission is to promote, protect, and preserve the health and well-being of the greater Nashua region through leadership and community collaboration. Our vision is to have an informed, safe, healthy, and resilient community where all people can thrive and prosper. We subscribe to the following values: integrity, leadership, adaptability, and respect. And from looking at what Bobby has provided in her report here, some of the biggest news is around reaccreditation. And we have completed all of our domains that are out for external review. We appreciate all the input that we've received so far, And our coordinator, our own Ren Bodwin, and Irida, as co-coordinator, have done an amazing job, and they have been very helpful, very attentive, framed out our work very nicely for us, and their efforts have been commendable. We were a little nervous, well, I was a little nervous going into this, and they made it much easier than I expected it to be, and it's an awful lot of work. Let's see, and we're still doing our weekly COVID testing for staff, if they so choose, and we're requiring masks in our conference room spaces and common areas. And we're mirroring what the healthcare facilities are doing as our response. Let's see. And I'll go to the second page. I just picked some random highlights from some of these other things. And certainly monkeypox has been keeping people fairly busy, and so have all the other coordination calls that staff do attend. And for behavioral health, they produce the Speaking Our Minds podcasts, and it's been completed in 5 languages. And Lisa brought it to our attention that there's a new element that Narcan is no longer effective for the substance use disorder population, xylazine. Because it's not an opioid, Narcan is not effective, and they're seeing that in some overdoses. Community health workers, as they usually do, are busy with community events. They have been chipping in with the sauna, syringe services, I forget the rest of the acronym, where it's a needle exchange program, pretty much. And I'm just trying to go through these really quickly. And our EPI is involved with monitoring COVID-19 and monkeypox. We are no longer going to be using live stories for a lot of our educational efforts. And so she has worked with Jane, to our public health, the acronyms are a challenge, to shift over all of our information to My Sidewalk team, which is fairly arduous, but they sound like they have a good handle on it. And our public health, what is Jane's title? AC? VAC? No.
Strategy.
Public Health Network.
No, that's Patrick. Anyway, Jane is chair of awareness and legislation group for Vaxwell, which is a statewide coalition working to advance immunizations. And she is working actively on transitioning our chat and chip from live stories to mysidewalk.com, and there are some other activities that anyone can refer to the notes. And, oh, no, maybe she, acronyms again. And our PHAP is also working on My Sidewalk and facilitated the Delta Dental Oral Health Project. And our FEP has been busy with National Preparedness Month, and he's also been very busy with a drill for our staff, and with environmental health, he is also participating in the unified coordination of the holiday stroll, which is very exciting because we haven't had one for a couple of years, and it requires a great deal of planning from an awful lot of people. And then our public health equity officer, that's Irida, acted as co-coordinator for accreditation, as I had said previously. And she also put together a really nice division-wide meeting on language access, which dealt mostly with people who are hard of hearing and how to assess, to provide the same information to them. Bobby, there are 2 positions that are open within the division. Public health nurse that is posted, and the program assistant and health promotion specialist is posted as well. And that is really, those were the highlights that I was able to pick up on.
Are there any questions from the board members? Oh, I'm
I
sorry.
have a few, thank you very much.
Sorry about that.
We go back to the accreditation process.
Mhm.
It's
Oh.
completely
Microphone.
over right now.
Oh.
Sorry. Sorry, Jim. Okay, regarding the accreditation process, when will it be, when will you receive the final report on that?
We don't know, because we've put together all of our domains and answered all of the questions and provided evidence throughout all of it. Now it's currently being externally reviewed, so outside of the division. Then the problem is that FAB, Public Health Accreditation Bureau, it keeps on pushing out a date from their organization, so it makes ours a little further behind. We're all set to go,
Oh, okay.
but, so I don't know when this will actually be over, because it's been pushed out, I think, about a month.
Yeah, if I may, they've had some issues getting their website set up. So all the documentation that we've pulled together and developed and whatnot has to be uploaded to this site. And so that's really what has created most of the delay here.
Okay. Can I continue?
Yes, sir.
Thank you.
Absolutely.
Also, the weekly DPHCS Incident Response Team meeting held, what is the outcome there? I mean, you said it was held. What was the outcome? Do we get an outcome?
Can you reference the page and the
The
paragraph?
first page on the director's update report,
Where are you on the page?
on the DPHCS Department Focus, down
Gotcha.
Okay.
1, 2, 3 bullets down.
Thank you.
Okay, we hold those are pretty much a regular meeting. And that's where we bring things from the individual departments to the whole group. For instance, I'm going to steal my own thunder here.
Yeah.
We had a second West Nile virus positive, so we bring that to the group. So it's how the department heads and backups share their information with the whole group. And they're the people who would be mobilized if there were an occurrence that we needed to be aware of.
One last thing.
Sure.
Report. And that is on the third page where it says participants in the Unified Coordination of 2022 Holiday Stroll. Are you allowing just the city to participate in that? Or can it be other healthcare workers
For the oversight of this,
involved in the participants in the Unified Coordination of the Holiday Stroll? Do you have enough people working there from the city to do what you need to do?
I think so.
Or can they have other outside healthcare workers, in other words, work that particular day
I don't know.
with the city?
We have a pool of volunteers that are CERT members that are involved, but most of the planning, this involves police, it involves fire,
Right.
all of us. I think we're all set, but,
Okay.
yeah, I can give another critical look at it.
Okay. I mean, from the healthcare perspective, not from the police perspective, because I know they are set.
Right, yeah.
Okay.
All set?
Yes,
Thank you. Any other questions, comments?
This is Stephanie.
Yes, Stephanie, go ahead.
Thank you so much. First of all, relative to the submission for reaccreditation, I just wanted to mention that the quality of the writing and the research and the projects was just really a pleasure to read. And I know you have indicated that the external review pending the repair of the website is the next step, but were you able to get all of the sections reviewed by people to your satisfaction? Is any further thing needed?
I don't really know the answer to that specifically. Ren would be able to tell you in a heartbeat because he's the coordinator. But I think that it's out among the people who were chosen to review all of the pieces. So I think that it's all been accounted for so far.
Okay, I understand that sometimes people commit to something and are not able to follow through. So if there appears to be delays, I would be willing to review additional sections. If you could let Red know, if that were needed. And then the other thing is, and this may be covered in other reports, we talked about having an update on our approach to polio vaccination to protect the children in our state. And if that can't happen today, then I would respectfully request that be put on the agenda for November, or there be an off-cycle communication with Board of Health members. I realize that we need to make that kind of information public, so whatever needed to happen to post that publicly, just so there isn't another month's delay in defining what that is, would be most welcome.
If I may, Flavia and I touched base on this this morning. Lindsay had expected to be here, but she was unable to. She has prepared for that. So I would guess, with Bobby's say-so, that it would most likely be appropriate to put it on the next month's meeting.
Okay, as long as we're not delaying the implementation of anything we should be implementing.
Correct.
To prevent, and my last question is, what is the policy of our health department relative to flu vaccinations and COVID vaccinations for staff now that several of the COVID vaccines are no longer on emergency use authorization, but rather are fully authorized by the feds? Are we mandating? Are we fully vaccinated? Thank you.
No, it's not the city's policy to mandate vaccinations.
Are we able to quote a vaccination rate for internally for the Department of Health?
I'm unaware of that.
Yeah, I don't, if I may, I do not recall providing a report in previous years. I'd have to touch base with our manager and our immunization program coordinator for our department vaccination rate.
That would be of interest to myself. I don't want to speak for the Board of Health members, but in terms of the steps we take to protect people that come in close contact with our staff. Thank you.
Thank you.
Any other questions? Follow-up? Okay. Okay. I'm just going to go out on a limb and say Kim's not here, but is there somebody giving Kim's report?
Flavia.
Flavia,
Hello.
AKA Kim.
Yes.
Thank you.
You're welcome. I'm going to go over some general department highlights from our report. For our programming, there's a general increase in volume continues surrounding all services. There was a significant increase in vaccine volume from August to September. The grid on page 2 of our report has been updated with the fiscal year to date. Fiscal year 13 column is on there. That started on July 1st, so it's reflective of 3 months of data. Second row down for child regular vaccine, no flu, no COVID. We saw an increase of 43% in September. Not an increase, I'm sorry. For fiscal year to date, 43% of all vaccines for that category were provided in September. This is most likely due to children getting up to date to meet school requirements. And the majority of vaccines for the month have been flu, second to being COVID bivalent boosters, and the numbers are all there. In September, we continue to provide extra evening clinics for school-aged children. This was helpful to provide those extra appointments for those looking to get caught up for school requirements. In September, we also began our flu season clinics, both in-house and in the community. For our sexual wellness program, sexual wellness clinics remain in high demand, with most clinics being booked full. We are awaiting finalization of HIV PrEP program. We are pending finance to set up a separate account and waiting for vendor approval for Quest Labs. For our behavioral health program, our staff started a PMQI project through SANA, the Syringe Services Alliance, to provide education on naloxone and collect data on individual experiences and comfort level using Narcan and others. This was brought on by findings that people were not administering properly or contacting emergency services when Narcan was used, and this is ongoing. For our lead program, that continues to see steady numbers with outreach to families, providers, and landlords. For our communicable disease program, we continue working with healthcare facilities for COVID and general disease outbreak management. There were 2 long-term care facility COVID outbreaks in September. We continue to provide infection control guidance for various types of facilities, which are calling us, childcare, schools, provider offices, healthcare, et cetera. And we continue to perform general non-COVID disease investigations. For staffing highlights, we currently have 2 openings for a public health nurse, a full-time and a part-time position, and we saw no applicants in the month of September, which is unfortunate. And our staff received training surrounding a streamlined referral system, Unite Us. Our staff will be able to make referrals to participating partners for various services. And those are the highlights from the report.
Thank you, Flavia. Any questions?
Oh, well, thank you, Flavia, wonderful. Just curious, how do you find out if people haven't reported the use of Narcan? How'd you get that kind of data? Just from self-reporting, or you just happen to be out and talking to people?
I think surveying. So the SANA program is twice a week, and we have usually a public health nurse that goes out and a community health worker, and talking to people. I know there's a level of involvement with DHHS as well, with the kits and providing the label and doing the survey while our staff is doing the survey. But yeah, I think it was mostly through connection with the community and just finding out information.
So they don't call EMTs because they're afraid of, I'm assuming,
Of
the Good
legal
Samaritan?
repercussions.
I see,
Mhm.
Okay, well, thank
Yeah.
you. Thank you.
Okay. I'm sorry, please.
Oh, thank you. It kind of pains me that we can't hire nurses, and I was wondering if we were competitive enough. What do we need to do as the city to make that job more competitive? You have any idea what we need to do to get at least applicants, such as maybe raising the pay? I don't know what the pay is, but it's really painful.
Yeah, I think
You're
it's
so understaffed.
Yeah, absolutely. Yep, we are definitely hurting having these 2 positions going unfilled. And, there are multi-factors involved with this, including the, pay scale, but also
Right.
healthcare in general. Overall, hospitals, providers are all short-staffed, so trying to pull from the same pool of resources has been tough. But I know both Kim and Bobby are receptive to ideas and thoughts and everything.
And share them with us, because our clinic is dramatically understaffed.
Right,
Mhm.
sign-on bonuses.
Yeah.
Maybe we can think outside of the box and perhaps come up with some more money to pay these people, because nurses are getting like $100 an hour, and that's a lot. A day, no. Is that a day or no?
That must be a day.
A day. I know my kids work in hospitals, and they were saying they're short of help too. But they're trying to be more competitive, and that means at least enticing nurses to work in the public health field. Either give them incentives like sign-on bonuses as well as more money. Did we think outside the box like that, or what? No?
I can't speak to that. It's above my level with the
Okay.
managers and administration.
Okay. It does pain me.
No, I know.
I feel your pain.
Yeah. Anything else?
No, that's it, thank you.
Okay. Any other questions, comments? Seeing none, we'll move on to Heidi, Environmental Health, please.
All right, so food service, we had, we're still under our average failure rate, but it seems to be climbing, and we do recognize that in the food service industry, like all others, staffing is a constant challenge, and they're having a real hard time keeping people, training people, and we've noticed a couple of times during inspections, people just walking off the job because they can go elsewhere. So we're trying to be very thoughtful about what we do, but still have to make sure that the public is protected. So it's a balance. We strategize to try to coach instead of penalize people, and I think that our approach is appreciated, but it's a very challenging time for business owners. And then, let's see. I just put some Board of Health numbers together for something yesterday, so I'm looking at this with different eyes. We're done with our pools. No notable anything with rabies. And I think most exciting is that the staff and I met with our FDA retail specialist about the FDA retail flexible funding model grant opportunities. And we're not going to take any of the grant money because it is primarily supposed to be for staffing, and we don't have the mechanism to do that. However, we will be completing the required self-assessment and then improvement plan that comes from that anyway. And we're going to chart it out, and we'll work very closely with this person. She's wonderful. It was really great to have her ear on some of our more interesting things that have happened, such as opening the Kava bar and other things that don't really fall within the realm of FDA guidance. And our staff participated in the FDA 2022 Retail Food Protection Seminar, and I spoke during the regional breakout session regarding dogs and outdoor dining. And it was actually a lot of fun, and it's very validating to see that other jurisdictions within the Northeast treat things largely the same way. And all that work that we did ages ago for our dog variants was, we were in the right direction because that's where a lot of people landed. And so I feel really good about our efforts there. And as I already said, our second West Nile virus positive mosquito was found in Nashua. The state person who called with the results, they're not concerned. There were only 3 mosquitoes total in that trap, which is almost unheard of, but considering the drought, we're just not seeing mosquitoes, and the public health lab isn't really processing many samples. And the nights have been cooler. Mosquitoes will not fly below 50 degrees. So as we see the nights cool, they become less and less of a threat, and the state public health lab will probably be discontinuing testing of any mosquitoes next week. And let's see, Ren has been working on the school health inspection form, which is really good because it's become very complex. And again, our reaccreditation efforts, that's about it from us. Ren has been a great champion for reaccreditation.
Any questions? Stephanie, you still there? Probably just listening. Moving on, then.
I am there, but I don't. I just
Okay.
stayed mute.
Thanks, Steph. Bob, please.
Good afternoon. Bob Mack, Welfare Officer for the City of Nashua, just reporting on the welfare statistics for September. You can see as you review the financials, there was an increase in the shelter or rental assistance line. That's primarily due to an increase in requests for that assistance, and also we've been filling in some of the gap between when the CAP agencies are able to process applications. They're continuing with their emergency assistance program. It's just taking a lot of time to process some of the applications because of the numbers of people that are applying for and reapplying for that assistance. So we'll continue to monitor that as we go. We are still, doing okay with our budget. We're about 17% expended for the FY23 budget. Last year at this time, we were at about 13%. But we actually had a little more in our budget last year, so that 13% and the 17%, it's pretty much on track,
Okay.
comparatively speaking. As you can see with the numbers of applicants and interviews and decisions that were made, there was a slight increase there. But we did assist about the same amount, 46% of the applicants that came through versus 44% last year at this time. And again, the vouchers, numbers of vouchers issued, there was that increase in the shelter / rental assistance category. We have been continuing to assist homeless households in motels if there's no shelter space available. We have been seeing some increase in single individuals that need some assistance in motels, as compared to historically speaking, if you will. A number of the folks within the homeless population, what we're seeing is kind of an increase in age and an increase in some health issues. And so we're trying to work with the shelters and healthcare providers to make sure that anybody that needs to go in a shelter program is set up with appropriate services that they need to sustain that. But some of those folks aren't necessarily suitable for that shelter, so they may be placed in a motel with some services, some home care services, if you will, targeted in those motels. One of the other issues is some people, they just can't get into a top bunk. So if there's a bed open, but it's a top bunk, they can't maneuver that. We may have to assist them temporarily until more suitable bed becomes available for them. So, and that's something we continue to work on between us and the shelter programs. And we'll continue to do that. As I mentioned, we continue to work with the CAP agency, refer people over to that program, and we'll monitor that program as it continues. The state of New Hampshire has pushed out some additional funding for shelter providers, as well as anyone looking to apply for winter sheltering. And Michael Reinke from the Nashua Soup Kitchen and Shelter has applied in partnership with an agency, 1269 Cafe out of Manchester, for some county funds. It was, I think it was about $270,000 for Hillsborough County that organizations could apply for additional winter overflow, low barrier sheltering. And so he was working on that application, submitted that application, and is just waiting to see if that gets approved. But that would provide some additional winter overflow beds just through the winter months, in addition to current beds. I believe I've mentioned previously that the shelter programs are looking to expand. The Southern New Hampshire Rescue Mission is hopefully opening their single female shelter program this month. That will provide some additional 25 beds for single female individuals that are homeless. And they continue to provide their shelter for the single males. They have anywhere from 35 to 40 folks that they serve on a daily basis. Let's see, so I mentioned on that. We've also been meeting, a group have been meeting to look at the encampment issue, and we've been working with outreach workers, DPW, Department of Public Works, Nashua Police Department, Fire Department, Risk Management, and I believe I mentioned the outreach teams from our community, coming from the shelter programs and Greater Nashua Mental Health. We have been talking about ongoing outreach to the encampments, people in the encampments, offering them alternative resources. It's their choice to accept certain resources. We did come up with a homeless services posting, if you will, so this is something that is being posted throughout the community that just indicates what resources they can contact. If at some point, if they don't want to access those resources upon initial contact, they can follow up and make a phone call or reach out to any of these organizations and get connected to those resources as they're available. So we continue to try to engage folks out in the community and connect them to resources, particularly with the winter months coming. There is also an upcoming Housing Stability Summit, and that will be October 25th, and a number of different community representatives from across the state will be coming together in Concord to talk about some best practices on how to address homelessness in different communities. The picture is not always the same in every community because every community has different resources and whatnot, but just to come together and look at some best practices should be a very positive thing. One other thing to note is the Greater Nashua Continuum of Care did complete and submit the Notice of Funding Opportunity application to bring approximately $2 million back to the community. That's primarily to fund existing housing programs that support chronically homeless individuals in permanent supportive housing. There's a small opportunity for additional funding. It's around $100,000 that's part of that application, and if the score is high enough, we may hopefully get some of that additional funding as well to create about a half dozen additional units. Let's see. I think that about covers it. I don't know if there are any questions.
Any questions?
One quick
Just check.
clarification on
Yep.
what's low barrier winter
Yes.
sheltering. Can you explain what that is?
So a low barrier shelter is basically a shelter. The current shelter programs, they do some screening. They don't want people in there that have been using substances, or there may be certain criminal behavior that they don't want to, that they exclude
Yep.
from the program.
I see.
The low barrier shelter is primarily that. It's a temporary, it's pretty much no questions asked, sort of. I mean, I don't want to speak specifically for the program, but
Sure.
the general concept
I
is
see.
if someone is not of a risk to themselves or others, they can come and stay in the program for the night. If they are acting out, if they're under the influence and acting out, or they're, falling down and not safe for themselves, they may need to be hospitalized or seek medical care, they would not be allowed to stay in that program. So, and for the winter months, I know generally speaking, and again, I can't speak for the shelters, but it's been my experience that they will work with whoever they can in their mainstream shelter programs, particularly during the winter months, to make sure people have a place to stay. But again, there are some limits as to who they can work with in some cases, if that makes sense. I hope that
Yeah, no,
answers
thank
your
you. Thanks
question.
very much.
Any other questions? Thanks, Bob.
You're welcome.
Anything else that you have, Heidi?
No, thank you.
Okay. Well, you're set. The last thing is public comments. You are the public.
Oh, yes, I'm Tricia Owens.
Right.
You're going to have to come up.
Oh, I have to come up?
Yes.
Big day.
And you have to stand on that.
You have to state your name and address.
An address. Okay, I'm Tricia Owens, and I live at 9 Riverview Circle in Litchfield. but I am here representing the Health Committee for NAACP Greater Nashua. And so I do have a few questions and maybe a couple comments. As a registered nurse myself in the state of Massachusetts, I was wondering whether, in terms of the employment and getting applicants for the RN, whether in community health you've offered sort of like a mother's hours or flexible hours, because it is kind of can attract a different person than, or a professional than a hospital setting, and maybe even, making it a part-time, or, to just open up the interest of other people. So that's just a thought on that. In terms of, Bob, I have a few questions for you. I was wondering, first of all, whether I could get a copy of that list, the homeless list sheet that you made up, and if that would be okay for us to post on our NAACP website.
There you go.
Thank you. That's terrific. I also was wondering about the application process. Is it complicated? Are there translators? Are there, does it have to be online?
Good questions. The application process for municipal welfare, you need to contact the office. We do basic brief intake, if you will, over the phone. You can come down to the office in person at 18 Mulberry Street as well, from 8:30 to noon and 1 to 4:30. You basically speak with a welfare staff. They ask some basic questions. We do serve Nashua proper, so we are for the city of Nashua. Each municipality across the state has their own municipal welfare / general assistance office.
So are you Greater Nashua?
We are Nashua.
Just
we serve
Nashua.
Nashua, the city of Nashua.
Yeah.
For instance, we had someone from Hudson who came in our office this morning, and we just referred them back
Okay.
to the town of Hudson. So, but we do have a rather substantial application. We do ask for income versus expense information. What's the basic need? What's your current situation? And what are your available resources?
Mm-hmm.
Depending on the situation, we can usually see people within a few days. If it's an urgent need, we try to see them, within the first 24 hours. But we do require some verifications. We need some ID so that we know you are who you say you are.
Mm-hmm.
And again, we want to serve people that are from Nashua.
Okay. And what about, since a lot of our population is not, English is not their first language, do you have translators or you have application in other languages?
We have application in Spanish,
Mhm.
and we do have Spanish-speaking staff within the department. We do have multiple languages across the division, but we also utilize the language line if there's a language issue with a language that we can't cover from on-site staff.
Mhm. Okay. Just really sort of curious about the accessibility and, what are the barriers?
Yes.
That would be. And so I'm wondering if you have any data in terms of, you talked about that there's some increase in people reaching out and single people. Do you track that data in terms of gender, race, anything?
Yes, we
age?
do have some of that data in our
Okay, so is
system.
that data that we could get access to in terms of the BIPOC community? Or is it not broken down in that way?
I think if you made a request, we could look at exactly what you're looking for. And
Okay.
we could try
Okay, great.
to complete that request.
Okay. All right, let's just see. I guess that was it in terms of the comments that I wanted to make. I just wanted to sort of make a little pitch for Greater Nashua NAACP that we are looking for people to serve on the health committee. It would be a monthly meeting, and really it's just at this stage, this is the first time there's ever been a health committee in the Greater Nashua NAACP. So I'm sort of collaborating with the Manchester NAACP, who has a very involved and an active health committee. So even if there are people that you're aware of that may have interest in just giving input, or they don't need to serve on the committee, I'm interested in just talking to people and trying to understand what the needs are. We're information gathering and trying to figure out what actually our health committee would be focused on, other than health equity for physical and mental health for the population that we serve, the BIPOC community. So thank you.
Any questions for Patricia? Thank you, Patricia.
Thank you.
Appreciate it. Any other questions, comments, good jokes, bad jokes? Doesn't matter?
Well, I don't know if it's appropriate, though. I want to reserve, I want to ask a question. The person is here, is not here to ask the question, but the email that came in regarding the incident that happened at Birch Hill. And I think that maybe I'll do.
Yeah, I think that's illegal right now.
Okay.
Any other questions? Seeing none, looking for a motion to adjourn?
Yes.
So moved.
Thank you very much. Thanks, everybody, for coming. Have a great Halloween. Don't forget to brush after all that candy.
Okay.
Bye now.
Thank you.
So sad.